I want to introduce Dr. Desiree McCarthy Keith, and we like to call her Dr. MK. She is a fertility doctor, and one of our topics in this series is what do we do about women who cannot get pregnant and why are they not getting pregnant? We're basically exploring this opportunity to see if we can help women who have had trouble trying to conceive and the ones who plan on conceiving find some simple tips and some avenues and opportunities to find a way to make it happen, because I think every woman who wants to have a child should have a child. And as an OBGYN and me being Dr. T, we're going to make it happen. All right, so Dr. MK, she did all her training, and actually she's very special because she did her training at NIH, which is the National Institute of Health, and she did research on fibroids, which we know a lot of women of color and non-color actually have this problem. Welcome. Hey,
thank you.
Welcome
Hi.
To Talk with Dr. T. And,
thank you.
And glad to see you're here in Atlanta. Tell us a little bit about yourself real quick.
Thank you for having me here and for shedding light on this very important topic. I think it's great to have an opportunity to talk about fertility for women, so thanks for the invitation. As you mentioned, I'm from North Carolina. I did all my training in Chapel Hill, went to college and medical school there, did my residency in OBGYN at Duke University, and then I did private practice OBGYN for 4 years. And then went back to the NIH for my fellowship training. I've been in Atlanta now for a little over a year doing specifically fertility care for men and women here, and it's been great.
Wow. Wow, that's a lot. And that's good because, once again, I'm glad you jumped into that field because so many women, and actually being an African-American doctor and knowing that realistically there are very few African-American fertility doctors who focused on women of color, Asian, South American, Latinos. These individuals, they tend to have special, unique interest in fertility. And talk to us about fibroids and their, the possibility of fibroids being issues for infertility.
Well, first of all, there is a large disparity when it comes to just women seeking fertility care, and that's mainly because historically a lot of the campaigns to educate women about infertility and the treatments were targeted to more the majority group. And I think that's one reason why women of color were not as well represented among women seeking fertility care, even though we know that women of color experience infertility similarly to women of other ethnic groups.
Let's talk about what's happening in our culture right now. We talked a little bit off camera, a little bit about the disparity between having babies and basically having a career, and this real balance of what should women do and what has happened and what has stolen the opportunity for women to have this type of scenario. And then we'll jump into what we can do and basically where we can go and so forth.
Exactly, I agree. And a lot of women unfortunately have sacrificed their fertility or put their fertility secondary to pursuing their educations and their careers, which is great. There's been a change just in society where we're not staying at home traditionally anymore, but we're getting out into educating ourselves and joining the workforce. But at the same time that that's happening, our fertility is changing, and many women are not aware of that or don't consider that when they're making their future plans.
So basically, what I hear you saying is they had to make a choice. That they basically, when I was growing up, I know a lot of the mothers were like telling women, look, you can't depend on a man. Your focus is, I actually had to depend on your father, and the avenues for me were very minimal. They pushed their young ladies, their girls, to basically get a career, not be dependent on a man, and that's been a double-edged sword. Is that what I'm hearing you saying?
Yes, it definitely has. And women have just become more involved in their educations. I remember my first year of medical school was the first year at the University of North Carolina that our entering class was actually 50% women and 50% men. It had been fewer women prior to that, but we're just seeing that increasing trend where women are educating themselves, and we're getting more into our careers and not focusing on the family first. And so that does put our fertility second.